You will be talking about macular vascular density changes after cataract surgery in diabetics, and you have compared it to the non-diabetics using non-invasive OCT angiography. Okay, welcome.
Very good morning, respected judges, panelists, and media colleagues. So, my study is on macular vascular density changes following cataract surgery in diabetic patients compared to that of non-diabetics using OCT angiography. I have nil financial interest. So, diabetes, as we all know, is one of the most widespread disease. Cataract and diabetic retinopathy often coexist. Cataract surgery can improve vision, but at the same time, it can accelerate the progression of diabetic retinopathy with macular edema. OCTA, a brand new non-invasive vascular imaging method which detects microvascular modification early in diabetic retinopathy. So through OCTA, we have compared and drawn the data of macular thickness, the superficial and the deep capillary plexus, and foveal avascular zone before and after the cataract surgery. The aims and objectives were, we divided the whole group into two groups. Group A consisted of diabetic patients ranging from no diabetic retinopathy to moderate NPDR, and Group B consisted of non-diabetic patients, and both of them were compared pre and post-operatively. Then we analyzed the consequence of phacoemulsification surgery on progression of diabetic retinopathy. So cataract patients were assessed for the eligibility. Patients who followed the inclusion criteria were taken, and we excluded the patient who were not fitting into the inclusion criteria. We conducted the ophthalmological examination and again divided the patient into two groups, Group A and Group B. Baseline parameters were taken, which included the vision, slit lamp examination, intraocular pressure, fundus examination, macular OCT, and OCTA. An uncomplicated phacoemulsification surgery was performed, and then these data were evaluated on day 1, 7, day 30, and day 90. And then we did a comparative analysis. So this is one of the example of the OCTA image that we got, and then we compared it using a software called Octava. These again are the images on post of day 1, 7, day 30, day 90. These were the results. We will be comparing the result in the following slides. So macular thickness, as we can see, we see an increasing trend for the diabetic patients till day 7. Then there is a plateau that is following from day 7 to day 30. And from day 30 again we can see a rise in the trend. Similarly for non-diabetics, we can see an increase till the day 30, and then the value decreases post day 30. Similar pattern for the SCP, we can see a steep gradual rise for the diabetic patients throughout from day 1 to day 90. Whereas in the non-diabetics, we can see a decreasing trend post-op day 7. These data, when compared, both of these were found to be statistically significant. For the DCP as well, we can see an increasing trend post 30 days and a decreasing trend for the non-diabetic groups post 30 days. The FAS again was compared, and we found similar result. Correlation analysis, the other group were non-significant, the HbA1c, blood pressure, but important thing to note, the visual acuity again was non-significantly different. So coming on to the discussions, it's a long known fact that phacoemulsification causes an increase in the diabetic retinopathy progression, macular edema. There is development and progression of diabetic retinopathy after cataract surgery. Studies done by Otsi et al., Chung-Hai et al., Thomas Hong et al. All proved the same. Leifeng et al., as we know, study highlighted the macular thickness rise after cataract surgery in both the groups, while there was only the increase in SCP. Zhao and et al. Showed us that the phacoemulsification diabetics causes transient increase only in the DCP values. In our study, we observed progressive increase in the macular thickness from day 1 to day 90, and significant in both the groups. Pong et al., he summarized the mechanism and told that there can be some inflammatory mediators that are responsible for this. The SCP and the DCP values became significantly higher at 3 months post-operatively. Yu et al. Stated a considerable increase in the perfusion and the vascular density in both SCP and DCP after the surgery. So to conclude, we can say that SCP-DCP density increases significantly only in diabetic patients at the end of 3 months after cataract surgery, which may have a predictive effect on the progression of post-operative DR. So we can have a concluding statement. We should avoid rushing cataract surgery in early to mild grade diabetic retinopathy patients. And OCTA has indeed proved to be a valuable tool in detection of early DR changes. These were some of the limitations of my study. It was definitely a small sample size. We had limited time frame to conduct the study, and it was a single-centered study. These were my references. Thank you.
Thank you. Well done. Any questions?
Good presentation.
Thank you, ma'am.
So, did you in your inclusion criteria, you had patients with ranging from no diabetic retinopathy to great, except for severe diabetic retinopathy was not included in your study,
yeah.
right? So, was there any difference in the vascularity in patients who did not have diabetic retinopathy and who had mild to moderate diabetic retinopathy?
So that is the thing, ma'am. In the non-diabetic groups also we found an increase even after phaco surgery, but there after say 30 days to 7 days, the pattern was decreasing. It was coming to normalcy.
You said
but
the density of
SCP,
vascularity.
SCP and DCP were again decreasing, but for the diabetic group it was increasing.
So, what is the reason for reduction in density of the vascularity?
So, ma'am, the inflammatory factors were transient in case of in both, but the amount and the degree of say the leakage that was happening, the inflammatory factors that were coming into play in diabetic patients were much large, so it couldn't come back to normalcy. Whereas in non-diabetics there were no other factors playing into play.
What was their glycosylated hemoglobin values and their sugar control?
HbA1c was under control, ma'am. We didn't
All
cross
the
the value of
patients?
6 Yes, ma'am. We have
In spite of control of diabetes?
Yes, ma'am. Yes, ma'am. We only good, well-controlled diabetic patients were taken, ma'am. And also, ma'am, the vision didn't. We didn't intervene in any of the study because the vision was not decreasing. It was not significant decrease, so we didn't intervene. Only it was at the vascular level that was we found a change.
It's a reduction of the pericyte cells in case of the diabetic.
Yes, sir.
This may be a factor for the thickness of
Yes,
the
sir.
fluid.
Microaneurysm. We have leaky vessels. That is the study that was done by you. He proved it was leaky, and thus there was increase in the macular thickness.
One
Okay,
question.
Thank you.
There
Thank
was
you.
increase in macular thickness in both the group, no?
Yes, sir.
Diabetic as well
And
as
non-diabetic.
So is there any other factor rather than cataract surgery which plays role in increasing the macular thickness? Like
in general,
steroid for 2 months, can it increase the macular thickness? Did
yes,
you
sir. Yes, sir.
notice this point or not?
Yes, sir. It can have, but mostly it was.
Is
not
there any study where steroid can cause increase in macular thickness?
macular thickness? Not that I'm aware of, sir. But mostly steroid-induced retinopathies are leading to CSRs. So intracystic or macular edema.
We have to rule out that factor also, whether cataract surgery itself causing macular thickness or maybe due to long-term steroid.
Yes, sir.
Because both the group we are getting increase in the thickness.
Yes, sir.
So that factor also should be considered.
Yes, sir.
Thank you.